Hi everyone, welcome to the second webinar hosted by the Digital Transformation team. These webinars will be hosted bi-monthly, so please keep your eye on the daily email to be up to date with anything that's on offer over the next few months. Today I'll be focusing on IPM, so our trainers David and Sam will go through add-on referrals, new waiting lists, and also follow-up waiting lists as well. They'll also be answering some of your frequently asked questions. If you do have any questions over the duration of the webinar, please drop them in the Q&A and we'll aim to get those answered for you during today's session. Please make sure you look into the featured tab of your Q&A, as that's where all the questions will be displayed. If you did pre-submit a question, they'll also appear here as well. Thank you all for attending and we hope you find this webinar useful. I'll now hand you over to David.
For this demonstration, a training environment will be used, so all patients and people I use will be training patients. So I'm going to be using a Ellen Harris. She requires a Mr. Hallowar referral and waiting list within 8 weeks. Okay, so we get a GP referral today for Ellen to see Mr. Hallowar. Okay, so I'm going to put in Ellen's hospital number first of all. Click on OK. So first thing, make sure it's a correct patient. So check the date of birth, check the address, right click. When attaching a referral and a waiting list, you can either do the referral first and attach it to the waiting list, or as I'm going to demonstrate, I'll go through the waiting list and attach the relevant referral. So we'll go down to waiting list. Ellen has got a current waiting list under Mr. Padfield, neurosurgery. It's really important that you don't duplicate waiting lists. So I'm going to add a new waiting list for Mr. Hallowar. So right click, create waiting list entry. I've got two choices, inpatient and outpatient. Inpatient is linked to the TCI to come in date. Outpatient is concerned with the outpatient waiting list, which is to do with new and follow-up waiting lists, which lead to appointments. So I'm going to go in on the outpatient option. Please be into the referral window. It's advised if you expand it down, you can see all the relevant referrals. So please make sure you select a relevant referral. The referral I'm interested in is a GP referral, today's date, to Mr. Hallowar Orthopedics. It's not on the list. So I'll click on none and then click on OK. Since you've not selected one of the matching referrals, do you wish to add a new referral now? Yes. Because it's a brand new referral coming into the trust from the outside, i.e. a GP referral, is classed as an external referral, and click on OK. This will now take me into the referral page. Okay, so with referrals, you've got three main sections. You've got your referral details, you've got your referred by, and you've got your referred to. So you've got to fill out all three sections. So date received, that's when we get the actual referral and date stamp it. Today's date, date on letter. You can either type it or you can use your arrows, put in the relevant dates. Referral source, 22 different options. Just make sure you choose the right option. So for this example, GP referral. When you put in GP referral, it fills the bottom left-hand corner for you. So if you do notice it's the wrong surgery, you can go in on the edit patient and that will take you into patient details where you can update the GP surgery. So make sure the information's correct. Reason, you'd select the appropriate reason. I'll leave that one as advice or consultation. Priority is mandatory. You can't leave it as not specified. If you're not sure, put routine, then you can update it. To show you that the referrals, I've got three sections which you've got to complete. If I try and click on OK, it's telling me I haven't filled out the referred to section. So clinician, Mr. Hallowar. So if I just press H, you can't spell it because if you then put A, it brings up all the consultants begin with A. If If you choose a clinician and they've only got one specialty, it goes in straight away. If they got multiple specialties, it says not specified. You've got to make sure you choose the right specialty. So we'll say orthopedic. Really important, check the details before you click on OK, especially the dates. Everything looks good, so I'll click on OK. Because I've gone through the waiting list page will now open. Okay, so just a little tip. Sometimes people click on the inpatient radio button rather than the outpatient radio button. If you look at the second tab, appointment details tells me it's a outpatient waiting list. If you notice admission details, it means you've gone on the inpatient by mistake, so just be careful. On the waiting list details tab, you've got two sections. You've got your referral details and you've got your waiting list details. So on the referral, it brings up a relevant referral, which we're going to link it to. Difference between set referral and edit referral. Edit referral, if you just need to edit the referral, i.e. you need to update the priority or you've put in the wrong consultant, you can do it on this page. So that's what edit does. Set referral, if you get to this stage and you realise you've linked the wrong referral, rather than closing the page down and going back in, if you click on set referral, find now, takes you back to the referral window where you can link the right referral. Okay, so that's the difference between set and edit referral. Waiting list details section, a lot of the information feeds from the referral. So you've got your clinician, you've got your specialty, you've got your priority, and you've got your admin category. Date on list. For a new waiting list, it's exactly the same as a referral received date. So it's today's date. List name. So all new waiting lists start with O. OPD, outpatients department, hospital, and the specialty. So we'll say OPD, Deraford Orthopedic. Short notice, you would tick that box by clicking it if a patient was willing to be seen at short notice if there's any cancellations. Okay, it's really important you don't click on OK at this stage because it will create a waiting list without you filling out the relevant tabs. So you would then have to edit the waiting list. So don't click on OK until you filled out all your tabs, which you need to. So appointment details, you've got a clinician in charge, you've got your specialty, the clinic. On the live system, these can be up to 9 characters. It's just basically telling you the consultant and where the clinic's being held. So MH, Mr. Halliwell, D for Deraford. You've got your local category. It tells you at what stage the booking process is at. So it's a 50-50 split. So you've got IP/DC, which is your inpatient day case. We're not doing those. You've also got OP, which is your outpatients, which does include new and follow-ups. Now, because Ellen is going to have an appointment within 8 weeks, we're not going to book the appointment, so we'll just say OP, please book. Okay. And the only other thing I'm going to do, go in on the comments, and this is where I can put some useful general comments. So I'm going to say 8 weeks, new appointment. Because I might not be booking the appointment, someone else might be booking the appointment. Okay, put in all the relevant information, I then click on OK. It will prompt me for a waiting list letter. Because this is a training environment, I'm not going to print off a letter, but on the live system, just check with your colleagues just to find out if it's your job to print off a letter. And as you can see, I've just created a new outpatient waiting list. You've got a little out, which does mean outpatient waiting list. We can see there's no appointment booked. There's no date in there. Time waiting in weeks is 0. So next Thursday, it will say 1. Week after that, it says 2. And if you scroll to the right-hand side, you've got your general comments, which I've just filled out. And importantly, on the right-hand side, the little circle on the left-hand side where it says out doesn't distinguish between a new or follow waiting list. So a new waiting list, OPD, tells me that's where someone will go through the new waiting list to book their new appointment. Okay. Okay, so I'm going to hand over to my colleague Sam, who's now going to show you how to do a follow-up waiting list using a different patient.
Thank you, David. Hi, everyone. I'm Sam. I'm another one of the clinical systems trainers within the digital transformation team. Next, we're going to pretend that Mary-Ann Edwards has seen Mr. Hallowell in clinic, and they would like to see her again in 8 weeks' time. So firstly, I need to find her using patient view. We have Mary-Ann Edwards here. We just need to double check that it is the correct patient. So I'm just going to check the name, date of birth and address. So I'm now happy that it is the correct patient. So I'm going to right click and go to waiting list. You'll see a prompt here has appeared to fill out no waiting list entries have been found for this patient. Do you wish to add a new waiting list entry now? I'm going to select yes to this one. So there's no waiting list on there because when the patient turned up for their last outpatient appointment, IPM will automatically remove it. Okay, please bear in mind, however, if your area uses e-outcomes, a waiting list may have already been added for you. So we are putting on a waiting list for an appointment. So I need to select outpatient and click OK. Our referral select screen appears here. Because it is a follow-up waiting list, a referral should always be on the system already for you. So here you need to go and select the appropriate referral. So we have our referral to Mr. Hallowell. So I've highlighted that one and I'm just going to click OK. A prompt has appeared to say that an alert exists for this patient. We always recommend that you do go in and view those alerts. So I'm going to click yes to that one. And now in the bottom right hand corner, I'm just going to click the close box and it will load up the waiting list screen for us. You'll see that a follow-up waiting list screen is exactly the same as a new waiting list screen, but some of the information you fill out is slightly different. So across the top there, you have your referral details. Again, if you have accidentally selected the incorrect referral, you can change it here. And then down the bottom, you've got your waiting list details. As you saw earlier from Dave, with the new waiting list, the referral date and the date and list must match. With a follow-up waiting list, the date we put here was the date the decision was made the patient requires another appointment. Because the patient saw Mr. Hallowell today, we're going to pop today's date in here. The clinician and specialty have been filled out for us. We need to go in and select the waiting list name. So all follow-up waiting lists begin with FU. Please note it's difficult to see, but they do actually begin with a bracket. So if you pressed F here, it would take you down to consultants whose names begin with F. So I'm just going to make sure I set the correct one. So in this case, I'm going to go with FU and Derford Orthopedics. You have your priority down the bottom. So this automatically gets pulled through from the priority on the referral. So if this needs updating here, you can go in and select it. Okay, and then we need to go to the next tab along. So we've got our appointment details tab. And you have your clinician and specialty, and we need to go in and select the clinic. Local category, because this appointment is required in 8 weeks' time, we're not going to go ahead and book it because we would only book any follow-up appointments if they're required in 6 weeks or less. Down the bottom of the screen, you've got your appointment by date. So we do always need to fill this out on a follow-up waiting list. So if you do know the date the patient requires their appointment by, you can manually type it in here. If not, if you press V on your keyboard, there is a handy power jump option on the right-hand side. So I'm going to select that they need that in 8 weeks' time and hit jump. And you'll see in 8 weeks' time, the date is the 19th of October. And I'm going to hit OK, and it filled out that box for us. Then we're going to move along to the coding details tab. All follow-up waiting lists do require an RTT code. So RTT stands for referral to treatment. To add one, you need to click the coding button on the right-hand side. And then on the drop-down, you're looking for RTT pathway. The code you put in here is a clinical decision. If your department uses paper-based outcomes, it should be recorded here for you. In this example, I'm going to put RTT04 as the patient is coming back for review following treatment. I've then clicked add and I need to click OK down the bottom. You can see that the RTT code has now been added. You can expand the columns if you just want to check that you have added the correct one. The next tab along is book suspend. So if this appointment was required in 6 weeks or less, this is where I would now go in and book the appointment. As I'm not doing that one today, I'm just going to go across to the comments. In here, I'm going to add that the patient requires an appointment in 8 weeks' time. Please note that some departments will put abbreviations such as 8/52. What means one thing in one department, however, may mean something slightly different in another. So I'd always recommend, where possible, avoiding abbreviations. And then down the bottom, I need to click OK. Similar to earlier, you'll see that it's come up with a "Do you wish to print a placed on waiting list" letter. Again, check with your colleague whether you do this or not. For this example, I'm going to click no. And it now comes up with a waiting list view screen to show that we have added the waiting list. Here again, you can double check that you have inputted the correct information. So you have your RTT code here. We've added our follow-up appointment comment, our appointment by date, and we have selected the appropriate waiting list name. Next, I will hand back to David, who will be answering some questions that were sent in to us prior to the webinar starting.
So got 5 questions, so 3 questions are linked to referrals and 2 questions are linked to waiting list. Okay, so the first question to do with referrals. I'm not sure how to use the referral tri-state box or boxes. So you can either go through the referral view or you can go patient view. So we go through the patient view icon, put in a patient's hospital number, click on OK. And if I right click on Amelia and go to referrals, here's the tri-state boxes. The reason they're called tri-state boxes, you've got 3 options for both sides. So at the moment, both are blank. If I click on one of those boxes, I'll get a black tick. Click on it again, I get a grey tick. And exactly the same on this side. So black and grey tick. Okay, so they mean different things. So 2 blank boxes means active referrals. If I black tick a box, it brings up that option. So in this case, completed referrals. If I black tick that box, it brings up completed and cancelled referrals. It's best practice if you grey tick both boxes. That brings up all referrals, active, cancelled, completed. And to show you what the icons look like, click on OK. So you've got a little red cross for cancelled. You've got a little folder with pieces of paper in it that's active, and completed referrals, a little empty folder. So sometimes people accidentally cancel or close referrals by mistake. So that's the best way to view all referrals. Okay, second question, can I change the referrals date received if added incorrectly? So again, if I go on patient view, put in a patient's number, go in on referrals, and I'll bring up all referrals. Okay, so what I've done in this example, I was supposed to put on a GP referral to Dr. Zychek today's date. I've messed up the calendar slightly. I've accidentally put in yesterday's date. So the answer to the question is, whatever you do, don't just go in on the referral and update the date. It looks like you're trying to manipulate the waiting times and referral times. Okay, so you need to cancel a referral first. Okay, which I'll show you how to do. So cancel referral. Date is today's date, that's fine. You've got to put an appropriate reason. So we'll say referral entered an error, and comments, could put a useful comment in. So we'll say wrong date received added. Because there are audit trails, so someone can go in, they can find out the comment. Okay, so wrong date received added. click on OK. Are you sure you wish to cancel the referral? Yes. And you get a little red cross. Okay. The important thing is you've got to put on the referral with the correct information. So new referral. Please note there are active alerts, so I would view the alerts. GP referral, class as external. Which will take me into the referral page, and this is where I put in the right information. So date received, today's date, date on letter, we'll say it was on the 22nd, referral source, GP referral, got to put in the priority, routine, and consultant, Dr. Zychek, whose specialty, he's got more than one specialty, so we're going to have to put in a specialty, we'll say neurology. Again, before you click on OK, check the information. Okay, so it's really important if you do put on the wrong date received, got to make sure you cancel it, put in the relevant reason, comment, and add another referral. Okay. Third question, what is a inter-provider transfer? So I'm just going to go in on this referral just to show you the tab. So you can either double click or you can edit referral. Again, I would look at the alerts. So some people call it IPT or inter-provider transfer. So just basically the transfer of clinical care to or from an alternate provider under the referral to treatment pathway. Okay, so the receiving organisation, they get a form MDS, minimum data set, and they fill out this information. So that's a inter-provider transfer. So that's the referral questions. A couple of questions to do with waiting list. Why does the list name for a new waiting list start with OPD and not new? So that's a good question. So I'm going to put in Amelia's number. Okay, so we've already discussed on the left-hand side, you've got outs for an outpatient. Little ticket within as an inpatient waiting list, which is concerned with the TCI. So on the right-hand side, we've shown the new, you've got OPD, you've got FU with a bracket follow-up. The reason why we use OPD for new and not the actual word new is because of the inpatient. All inpatients start with a consultant's name, doesn't start with IP. So we could have an example where we have a doctor called Dr. New, which would throw the whole system and cause major confusion. So that's why new waiting lists start with OPD. Okay, and the final question, can I view or reinstate a removed waiting list via the patient view icon? So the simple answer to that is no, you can't. The reason for that is once the waiting list has been removed, it disappears off patient view. But I'll show you how to view a removed waiting list, and I'll also show you how to reinstate a removed waiting list. So you don't go patient view, you're going on this little icon, which is your waiting list view. Okay, you put in a little bit of information about the patient. So we're going to put in a patient called Andrew, whose hospital number is that. We're going to put a little bit of information. So again, I'm looking for a waiting list under Mr. Hallowell. He's got more than one specialty, so I'll say I'm interested in orthopedic. And again, you've got these lovely little tri-state boxes. So again, just be careful what you put in. I'm looking for outpatient waiting lists without any appointments. And the combination is that. Okay, all these tri-state combinations are in the manuals as well. Okay, really important at this stage, don't click on OK, because at the moment I'm bringing up current outpatient waiting lists without an appointment for Andrew under Mr. Hallowell. I'm interested in removed waiting list. So you go to the Advanced tab, you click on this little button once, patients removed from list, you get a little black tick, and then click on OK. Any removed waiting list will have a little red cross. So you don't disappear. The actual reason isn't on the highlighted line. So the easiest way, remove waiting list entry, and that will tell you the date of removal and the removal reason. So in this case, patient request. Okay. If you do need to reinstate a waiting list, personally, I would put in the removal reason first for not specified, and you would then delete the date. Some people delete the date first and put in the removal reason is not specified, but sometimes the date goes back in. That's probably best to do it that way. And as you can see, the waiting list has been removed and it would appear on patient view. So it's really important, if you need to reinstate a removed waiting list, if you're not sure what it is, whatever you do, don't go back in on patient view and add another waiting list. You'll come up on a data quality report. It's on the waiting list view icon, but make sure you go on the advanced tab. Okay, so that's the end to all the questions and answers and today's IPM webinar. Thank you for attending, and I hope the session was of some use. If you've got any ideas on future subjects, if you could email the digital transformation team. There's also knowledge articles, videos, manuals, trifold leaflets on the IT help icon, which you find on your desktop. Okay. The following face-to-face drop-in sessions are available in September. You've got EPMA on the 8th. There's an open session on the 13th that you can come in and ask about all systems. On the 19th of September, there's an IPM session, and there's also on the 27th, there's PCM. Okay. The dates are also available on the Digital Care Hub webpage. There's a link in the Q&A chat for a quick 2-question non-feedback survey. Thanks for attending, and hopefully we'll see you again.